Hi, my name is Michael Klimowski, and this is my presentation on low testosterone. Low testosterone is a condition that affects millions of men and women every single day. Testosterone is known as the male sex hormone as well as the counterpart to estrogen, but it is important to note that both hormones are found in all individuals, assigned male and female at birth, and that having low testosterone will present with a series of symptoms that all feed into each other rather negatively. Testosterone in men is responsible for deepening the voice, increasing muscle mass and bone density, the growth of facial hair, sperm production and fertility, libido, and sexual function. Men's testosterone levels will naturally decrease as they get older, but in men over 50, about 30% of men will have levels that are considered low. The normal range being 300 to about 1,000 milligrams per deciliter. Anything under 300 could be considered low testosterone, which would present with a host of symptoms such as low libido, which is a sense of arousal or sexual attraction, erectile dysfunction, which is the ability, or in this case, inability or difficulty to achieve or maintain an erection, increased body fat, reduced bone density, a loss of muscle mass, fatigue, depression and mood swings, and cognitive changes. So when you look at the symptoms of low testosterone, you'll notice that they negatively impact mental and physical health in ways that will dramatically decrease quality of life. And as I previously stated, they all feed into each other rather negatively. Fatigue itself is defined as a sense of exhaustion that does not go away with rest, which makes it difficult to do some of the diet and exercise portion of treatments for low testosterone. And then you look at reduced bone density and muscle mass, making you quite weak. That feeds into the fatigue. The fatigue feeds into depression that is triggered by an increase in body fat. So you're losing muscle density, bone density, you're increasing fat, which is affecting your depression. And again, this is a condition that affects typically men over 50, and they will already start to have some cognitive deficit. The mind is one of the first things that goes. In this case, low testosterone can increase a sense of depression and mood swings, as well as several cognitive changes like verbal memory. Verbal memory is when you hear something, your ability to remember it. Like any conversation you have with two people or watching this video, it could be very difficult if you suffer with low testosterone to remember the things that you've heard. And that can further contribute to a sense of frustration and depression. Fortunately, though, there are treatments, and very, very successful ones. Studies have shown that introductions of exogenous testosterone into the body can radically reduce, if not completely remove, all of the symptoms of low testosterone. Those treatments include TRT, which is testosterone replacement treatment, which is a form of HRT, hormone replacement therapy, and as well as oral medications and lifestyle changes. There's several different ways to go about treating low testosterone. The first of which being TRT. There is a shot that you can take of exogenous testosterone into the meaty part of the buttocks once every 1 to 2 weeks. There are topical gels and creams that can be applied to dry arms. There are transdermal patches which can be used daily. And there are, most popularly, testosterone pellets, which work very similarly to IUDs in women. It is a pellet about the size of a grain of rice that is implanted under the skin, either on the buttock or the thigh, that will slowly release testosterone into the body over a period of about 3 months. So you would get this one every 3 months. and that works very, very well to reduce or remove the symptoms of low testosterone. There are other treatment options, however, including oral medicines such as clomiphene citrate and human chorionic gonadotropin. These work to increase the body's ability to produce testosterone by stimulating the Leydig cells in the testes to do their job, as it were. And there are lifestyle changes that you can do as well, such as diet and exercise, as well as addressing the root causes of low testosterone. Now, while many of the causes of low testosterone can be either unknown or relatively natural, there are things to do with diet and exercise that can radically improve your symptoms. In relation to diet, there are foods that you can eat that will increase your body's testosterone. Foods that are high in protein, healthy fats, fruits and vegetables, fiber, zinc, and vitamin D will increase the body's natural testosterone. These foods could include fatty fish, dark leafy greens, so cruciferous vegetables, cocoa products, avocados, eggs, berries, cherries, pomegranates, and shellfish. The key to take away from this is high quality natural fats. Fats that are high in omega-3 or omega-6 fatty acids have been clinically shown to radically improve the body's testosterone levels. But there are also foods to avoid as part of a balanced diet when dealing with low testosterone. These foods include deep fried food, food cooked in oil, processed meats, preserved vegetables, legumes, beans. These things should be avoided because they have been shown in clinical studies to decrease the body's natural testosterone. So when you are avoiding foods you shouldn't be eating and eating foods that you could be eating to raise your testosterone levels, that can have a massive impact. But that's not going to be true for everybody. It would be a part of a treatment plan that you would work out with your doctor that could also include exercise, if possible, given fatigue, bone density loss, muscle mass loss. Those exercises would need to be formulated with a physical therapist, and exogenous testosterone as well. You and your doctor might see about a combination of treatments to sort of maintain control over your body's hormone levels and, ideally get back to normal. The takeaway from all of this is that you should at maybe 30, 40, and 50 be taking with your doctor a blood test, a blood serum test to check your testosterone levels. And if you find that they are under 300 or 250 milligrams per deciliter, to talk to your doctor about maybe looking at some treatment plans for low testosterone. There's no shame in this medical condition, as again, this affects almost 30% of men over 50 and over 8 million men every day, as well as women. They could experience symptoms such as this alongside menopause. So talking with your doctor early and often, and being aware that this is something that can happen, and being aware of these symptoms and their relationship to this medical condition can actually give you a massive sense of control over a condition that ultimately seeks to disrupt the quality of life. And with that said, it's a devastating condition, but a very manageable and a very treatable one. Thank you for your time.